conference, which is being facilitated by officials from the Ministry of Health. I am Press Secretary Philomena Robertson. Thank you to members of the media for joining us this afternoon, and also to the listening and viewing audience for tuning in to an accurate and reliable source of information. Now, this afternoon, I have with me Dr. Tahisha Donnell, who is the Acting Director of Medical Services at the General Hospital, Dr. Darlan Noel, the head of the COVID-19 Medical Response Team and also head of Internal Medicine at the General Hospital, and Nurse Audrey Lyons, who's a senior community health nurse, and she's also the manager of Grenada's expanded program on immunization. Now, the COVID-19 pandemic and its widespread impact has been a bit depressing for many of us. But this afternoon, in the midst of all of that, we are bringing to you some positive news. Yes, still pandemic related, but with a positive slant. And we want to maintain that approach for the press conference this afternoon. The government, through the Ministry of Health, has come up with a number of initiatives that are designed to curb the rate of deaths among COVID-19 patients. We are aware of the figures. We see the dashboard daily, and we see what the figures are. So these initiatives are designed to help curb that situation and also to engage in further outreach at the community level that are also designed to create better outcomes for persons who test positive for COVID-19. So at this point, I'll invite Dr. Tahisha Donnell to make an opening statement. Dr. Donnell?
So good afternoon to everyone, to my fellow panel members, my colleague, Dr. Darlan Noel, Nurse Lyons, our EPI manager, to Philomena, our press secretary, and to the members of the media. So good afternoon. Over the last few weeks, we have seen a significant rise in the number of cases and also in hospitalizations related to COVID-19. Of note, and happy to say, over the last week, we've seen a steady decrease in the number of positive cases that we have on island. We've also noted that persons have heeded that call, the call to be vaccinated. We noted that persons came out in droves at all the various pop-up clinics all across Grenada, Carriacou, and Petit Martinique. They came out to get tested, they came out to get vaccinated. And for this, we are happy that persons are heeding that call. We continue, however, to urge persons to get vaccinated and to help curb the spread of this disease and prevent hospitalizations. At hospital services, we cared for many patients, including our own healthcare workers, and we are happy to say that of our healthcare workers, they all recovered and are at home recuperating, and some are already back to work. On average, we can report between 3 to 6 discharges on a daily basis of persons who have recovered and who have been discharged home to continue their recuperation. We've made many adjustments along the way in an effort to increase capacity and provide the best care for our patients. At Accident and Emergency, you would have noted that we established a flu clinic, an area where all persons with COVID-like symptoms or flu-like symptoms can be attended to outside of the regular triage area. You would also note that our wards have expanded. Our isolation unit has expanded, and we now have capacity at the General Hospital for up to 93 patients. However, we have never gotten to that point. The most we have gotten to has been up to 64 patients. We also have expanded to establish a critical care unit with 4 beds for ventilation. So this area is our critical care area solely for COVID-19 patients. and it's outside of our ICU for our regular non-COVID patients. At our radiology department, we were able to set aside an area just to do x-rays for COVID positive patients. So these patients did not have to do their x-rays at the regular x-ray unit. So we're happy about that. At our lab, we had to set up a whole new department, our molecular diagnostics department, which is the department responsible for conducting the PCR test. And again, we are very happy to say that it's been flowing very well, functioning very well. Of course, our lab technicians, they've been working some crazy hours. But we just want to give them kudos for the hard work that they've been doing and for ensuring that we are up to date with our test results. For our patients and their families, we have established a COVID-19 patient liaison group. This is to assist and ensure that family members can be updated and can connect with us and get an update on the status of their patients and their family members. We continue to make adjustments, and our adjustments now have been spreading far and wide to extend into the community. Now, community has been doing quite a lot in this COVID-19 pandemic. The nurses, the DMOs, all of the staff members, surveillance team, everyone within community, they've been working extremely hard during this pandemic. And now we've seen the need to make a few more adjustments. And I would let Nurse Lyons speak about these adjustments. However, we've decided now to start up with a whole initiative to improve the monitoring and follow-up of patients within the community. As you would realize, the majority of COVID-19 patients, the majority of them have mild illness, which means that they are cared for at home. However, it is important and very necessary to have proper follow-up of these patients so that we can identify the warning signs very early so we can prevent severe illness and encourage early hospitalization. So today we would speak a bit about that. We would also speak a bit about the whole issue of vaccination. Vaccination among the high-risk group. A lot of persons, we noted during these pop-up clinics, that they were concerned about whether or not they should take the vaccine if they were pregnant, if they were breastfeeding, if they were over 50, if they had any chronic illness. So today we would clarify all these doubts so that persons can now know that yes, you can get vaccinated even though you have these conditions. So now I would pass on to my colleague Nurse Lyons, who would speak about what's happening in the community and all the initiatives that will be started to help improve the outcome of the patients, because the aim is to identify the cases early, identify warning signs early, and have early intervention to prevent hospitalization with severe illness. Thank you.
Thank you, Dr. Donald, for that introductory statement. And as you indicated, we'll go right over to Nurse Lyons, who has been leading things at the community level. Nurse Lyons?
Good afternoon, Ms. Robertson, and pleasant good afternoon to Dr. Donald and also to Dr. Darwin-Well. To our media personnel, pleasant good afternoon to you also. To the viewing and listening public, good afternoon all. All right, so as said before, I'm Nurse Lyons and I'm the manager for the EPI program and presently performing the role of Senior Community Health Nurse at the Ministry of Health. The Community Nursing Division of the Ministry of Health has been playing a major role in this pandemic. And I would like to just start off by giving a quote of our vision statement of the Community Nursing Division. So the Community Health Nursing Service aim to provide and to promote and provide high quality health care that are appropriate, affordable, accessible, and sustainable to all persons utilizing the health promotion strategies, thus reducing morbidity and mortality in the community. Given the current epidemiologic situation in our country at present, I want to take the opportunity to commend all staff within our community health district, with special recognition to our community health nurses and those performing the role of the community health nurse. These nurses have been providing human service to our citizens in light of this COVID-19 outbreak. Many of our services have been interrupted because of our health system is presently challenged in terms of COVID-19 contact tracing and testing, for which are critical to alleviate the current epidemiological situation. Nevertheless, we continue to serve with excellence to meet the needs of our population. Our staff have been on the ground since COVID came to our shores and working around the clock with little or no time off, leave or rest. However, there are some challenges in providing COVID-19 services in the community. Many of our staff had become infected and some had to be on leave due to other medical reasons, significantly reducing our human resource, thereby putting a strain on those that are there to meet the needs of the public. We have since implemented various strategies to assist in the COVID-19 response and day-to-day activities in the clinic. So, the Ministry of Health, in collaboration with SU, specifically Windrift, on Monday, 27th September, have commenced vaccination and testing at the Guava Health Facility, the new facility at Guava, that's a Guava Polyclinic. This will be conducted on Mondays, Wednesdays, and Thursdays between the hours of 9 a.m. and 3 p.m. All right. Reassignment of the healthcare services from the smaller clinics, some of the medical stations, to the health centers and other medical stations. So the Sept Health Center and the Guava Health Center, the hours has now been extended to 8 p.m. So commencements 8 a.m. in the morning to 8 p.m. at night. The St. David's district also had challenges with staffing, human resource, but has since resumed their on-call services. So just to give you a little insight, the St. George's district presently closed is Montmorris Medical Station, Manjaloo, Laborie, and New Hampshire. However, Snug Corner is open, and maternal, people can access the maternal and child health clinic on Tuesdays, and DMO clinic, that's the doctor clinic, on Wednesdays. Okay? And the nurse there, the nursing staff there will then be assigned to the St. George's Health Center, where it's a little bit heavier with the testing and the vaccination and responding to calls and so. Good Hope DMO, the doctor clinic, will be there or be conducted on Tuesdays, and on Fridays you can access the maternal and child health services. Woburn Clinic, DMO clinic on Thursdays, and on Mondays we have the maternal and child health clinic. Other clinics will in the St. George's area will function as normal, namely the Happy Hill, Granans, which is a very busy clinic, is functioning like a health center, and the St. George's Health Center. So that's for the St. George's Clinic. With that being said, we also will be responding to all emergency calls. There will be someone at the clinic that will be taking the calls and referring the calls to the nurse, whether they're at whatever clinic they're at. If it's St. George's Health Center, it can be Grandans, and we'll be responding. The persons with underlying conditions, you won't be left out. We will be visiting you from time to time. And if you have any concerns, even though the nurse will have visited you today, and you have a concern, feel free to call. St. Andrews, Birch Grove, we'll still be accessing the maternal and childhood clinic on Wednesdays. That's Wednesday the 6th of October, and then it will go back to regular from Monday the 18th and every other Monday thereafter. Mount Carmel, the maternal and child health clinic continues every other Monday. Carriacou and Petit Martinique and Hillsborough remains the same. So it will be open daily and continue the regular services there. Testing and vaccination on Tuesdays and Thursdays at the Hillsborough Health Center. Leicester Medical Station, all the services remain the same at Leicester Medical Station. Windward Clinic. On Mondays, we have maternal and child health, and on Tuesdays, DMO Clinic. Mount Pleasant Medical Station. On Thursdays, we have the DMO and the maternal child health. St. Patrick, starting from October 4th. As I said, the hours will be from 8 to 8 p.m. So the nurses there, the staff there will be doing shift 8 to 2, and some will take over from 2 to 8. On Mondays, however, it will be open from 7 a.m. because we have the weekends which will be covered. Every weekend will be covered. So every Saturday and every Sunday, 24 hours, there will be a member of staff present to assist the general public. Hermitage Medical Station, Tivoli Medical Station, and the Riverside Medical Station. Let me see. Union Medical Station will be open on Wednesdays and Thursdays for the maternal and child health and the DMO clinics. DMO on Thursdays, on Wednesdays, maternal and child health clinic. Riverside on Tuesdays, maternal and child health clinic, and on Thursdays, DMO clinic. Tivoli, which is presently housed at a Homa. Tuesdays will be the antenatal and maternal and child health, and Mondays, DMO clinic. Hermitage will remain open from Mondays to Fridays. St. David's Health District. DMO clinic every Tuesday at Croshoe Medical Station, and the maternal and child health every Thursday. Westerhall Medical Station, DMO clinic every Monday, and Vincent's Medical Station on Wednesday 6th and 20th. You have the DMO clinic at the Vincent's Medical Station. For persons accessing antenatal and child health services for Vincent's, they can always go to Penmotor Medical Station on Thursdays. Okay. St. John's and Mac, closure, and the Florida clinic has been closed, and we reassign the clinics will be the Guava Health Center, that's in the town, and the Grand Roy Medical Station will be open on Tuesdays and Thursdays. Okay, so Guava Health Center, all the activities there will remain as the same. Granbra Health Center, all the health centers will remain as same, just a little bit more activity there because some of the staff will be concentrated in the health centers mostly to respond to calls and to assist with the vaccination and testing. All right, we are also in the process of putting some care packages together for distribution for those who have tested positive. The home care packages was designed for daily monitoring of COVID-19 cases who are identified to be at risk for severe illnesses. The aim is to identify individuals with early signs of clinical deterioration in an attempt to reduce hospitalization and mortality from COVID-19. We are looking to commence with 250 care packages in the first instance As the supply becomes more available, more will be distributed. And the target population for this intervention, as we say, for the positive case, but we'll be zeroing on pregnant women, persons with underlying medical conditions, obesity, persons over 60 years of age. Mention must be made to PAHO, who has pledged a donation of 5,000 pulse oximeters, which we are expecting very soon. And these care packages, what do they contain? What are the contents? Pulse oximeters, so we can check your oxygen saturation, digital thermometers, hand sanitizers, face masks, and information leaflets. We have already started recruiting drivers to transport the nurses and the team to deliver these care packages to the home, and so the nurse will educate the people on the use of these items. In regards to education, the Community Nursing Division is ramping up on education in the facilities and in the home as they distribute the care packages. Brochures developed by Health Promotion Department will be incorporated in the packages with warning signs and when should someone seek medical attention and so. We also will focus on education as it relates to breastfeeding and the pregnant mother, as Dr. Donald had said, that we realize a lot of people are still querying whether it is safe to take the vaccine if they're pregnant or if they're breastfeeding. So we'll be doing a lot of health promotion activities surrounding that. Vaccination continues at the National Stadium, Monday to Fridays between the hours of 9 a.m. to 2 p.m. St. Augustine Medical Services, Tuesdays and Thursdays. Dr. Martin's office daily, Dr. Lowe office on Thursdays. All of the health centers and some of the medical stations, we ask you to call in advance. And the reason for that is because the vials come in multi-dose vials, we're trying to avoid wastage. However, if you go at the National Stadium, you don't have to make an appointment to go there. And we continue to do pop-up clinic around the island, mostly on weekends, so we can increase on the vaccination testing, and testing. We, however, would like to reassure the public that the measures taken is reassigning the clinics is temporary and is hoping to resume clinic as soon as possible. We are asking for the public's cooperation and would like to admonish them to use all communications available to reach out for help if needed. Thank you.
Thank you very much, Nurse Lyons, for a very thorough look at the initiatives being taken at the community level as we seek to balance the care of regular patients and also persons testing positive for COVID-19. It is extremely heartening to hear about the impending launch of the care package program for persons at risk. This initiative, I'm sure, will be welcomed by persons within the community. We now go over to Dr. Dolan Noel, the head of the COVID-19 medical response team at the General Hospital. Dr. Noel, I'm sure you've been instrumental in ensuring that we do more at the community level to lessen what you're seeing at the hospital.
Definitely. Right, thank you very much, and acknowledging my colleagues, my medical director, Dr. Donald, and Nurse Lyons, to our technical team, and to the viewing public. I will just expand on what Dr. Donald has said. I'm a clinician, and we manage as a team at the St. George's General Hospital. As my medical director has mentioned, we had increased our capacity to cope with the unanticipated surge from the Delta variant, which is no stranger to us. We have seen the effect of Delta in other countries. And we know that Delta variant is highly transmissible. We know that Delta variant is more deadly. And we know it's even more contagious than chickenpox. So the impact of Delta in a population can be very devastating. So in preparation for that, we do have a very strong clinical management team at the St. George's General Hospital. We have established the 5 isolation units with a capacity of 93 beds. According to international infection prevention control policies, and that team is staffed, the units are staffed 24 hours. So I have a team of 11 doctors who are working full-time with me on that unit. And as we speak, I want to acknowledge all of those physicians. We have a team of nurses, housekeeping staff, the people in the gas bank who ensure that we have uninterrupted oxygen supply. So it's an entire team ensuring that the patients receive adequate care while on that unit. So over the last couple of weeks, as the pandemic continued to surge to our population, we have had a lot of admissions and a lot of discharges. On a daily basis, we have about 5 to 6 people who are successfully treated and are discharged home to continue the isolation. So, having been a clinician on the ground, what I want to emphasize is that we see certain high-risk patients. And I can tell you who are the high-risk patients that are most impacted by the Delta variant of COVID-19. We're seeing a lot of the obese patients who have body mass index more than 30, and it is well documented that obesity is a high-risk factor for morbidity and mortality in COVID-19. We've seen diabetics, hypertensive, people with chronic lung disease, COPD asthma, patients with renal failure and end-stage renal disease, patients with cerebrovascular disease like strokes, patients with cardiovascular disease, having had previous heart attacks and so. And we are seeing patients with malignancies. They have cancers, they have tumors in different places, brain tumor, lung cancer, colon cancer. We are seeing people with autoimmune disorders. And we are seeing a lot of the elderly being impacted. So to the listening audience out there, what I do want to emphasize is that this is the high-risk category that is most impacted by COVID-19 and that highly transmissible and contagious Delta variant. Those are the group that we have to protect. Those are the vulnerable group who are susceptible to morbidity and mortality from COVID-19. So I'm always a big fan on prevention. I'm always a big fan on taking care of those people to prevent them getting to me. We do save a lot of them, but you know that COVID-19 have a high mortality and we will lose a few of them. But we save a lot more than we lose. Many of them come in on stretchers, cannot breathe, and they walk out of the institution into their vehicles. And I commend my team for that. Now, how can we prevent that? And it is simple. I can give you 4 basic preventative strategies. One is not to let our guard down and to continue with our social distancing. Keep away from large gatherings. Maintain your 6 feet where possible. So that's one of our behavioral changes. The other one is wearing of mask, and quite often it makes me extremely sad when I see people wearing the mask below their nose or the mask is underneath their chin. Delta variant does not take much to infect you. Somebody have the mask below their nose and they sneeze, they cough. Please admonishing you to wear your mask properly. So that's 2 behavioral changes that can prevent your relatives and your elderly folks from getting to us. A third one is hand hygiene. Simply sanitizing with at least 70% alcohol or washing your hands. And let me tell you how important hand washing is. Bear in mind, if somebody with COVID-19, you don't know they have COVID-19, you're sitting on a bus next to them, and they cough and they sneeze on you without wearing a mask properly, that virus can stay on your clothes for 48 hours. You go home, you touch it, and you touch your eyes, you touch your nose, and you touch your mouth, and you get COVID. Because the Delta variant, my dear friends, is extremely transmissible and highly contagious. 3 interventions, simple interventions: social distancing, wearing your mask, hand hygiene. You go to the supermarket and you roll the trolley in. You don't know how many hands have touched the trolley. You don't know how many people have sneezed on the trolley. And the virus can stay on metallic surfaces for up to 6 days. So all of those interventions is entirely dependent on us. The fourth intervention that is within our control is vaccination. Simple. And what I want to tell you is that when I look at some of the elderly people who have had strokes and they're paraplegic and they have not gotten out of the bed in years and they're just suffering with severe pneumonia and acute respiratory distress syndrome from COVID-19 through no fault of theirs because they have never left the house. We know that somebody took it to them. When you have children at home, and you know that children below 12 are vulnerable, children get a very serious illness, multi-system inflammatory syndrome, and that can be deadly. You have children at home, you have elderly at home. I admonish you to stop thinking about just you and think about the impact of all those elderly people, the ambulance making 6-7 trips a day, bringing those elderly people into hospital. And one intervention number 4, could help reduce that by you vaccinating yourself and you vaccinating the elderly. So if they do contract COVID, then the risk of hospitalization and death is less. So we have to think not of us only as individual, but we have to take the broader picture. You have to think of your elderly relative at home. You have to think of your young children who are not yet eligible for vaccination. You have to think that if all of us vaccinate, then the virus cannot spread through the community at that speed at which it did. And even if you have had COVID, once you recover, you should still vaccinate. Hybrid immunity, you're strengthening your immunity. So if you do come down with COVID today and you recover in 10 to 14 days and you're asymptomatic, the very first thing you should do is to vaccinate, not just to protect yourself, but to protect your loved ones. So I admonish you that the preventative strategies are very important. And listen to your doctors. You have an internal medicine doctor. They have to do 3 years to get a degree to enter medical school. They have to do 4 to 5 years of medical school doing medicine. They have to go specialize another 4 years. Guys, these people study for 11 years. And they're telling you that if you take the vaccine, you have enough neutralizing antibodies as a defense. So if you do come down with COVID-19, you have a mechanism to protect you. And you're not listening to them. You're listening to an overnight Google doctor who studied nowhere that is telling you all sorts of conspiracy theories. And in the process, it results in the death of a loved one. Let us look at the bigger picture. let us not think just about ourselves, but think of our community, think of our country, think of our loved ones, and please, the 4 preventative strategies I've mentioned, social distancing, hand washing, wearing of your mask, and vaccination would go a long way in giving us a healthy society. The other thing I want you to be mindful of, because we're on the ground and we're managing the patients, there is something called post-COVID syndrome or long COVID syndrome. And it doesn't get in COVID. Some of you may have it mild, but there is the sequelae afterwards. There are some people who left with a period of long-standing chronic fatigue. They left with cough. They left with pneumonias. And there may still be things about the virus that we have not yet discovered. So think about all of those things. The second thing I want to admonish you is the high-risk categories I've mentioned. Help protect those people. Help preventing them from getting the infection by you taking the precautions, including vaccination. Help protect them by ensuring that they take the medications and they're controlled. When they are not controlled, the diabetics are not controlled, the heart disease patients are not controlled, they have a weaker immune system and they're more susceptible to the virus. So ensure that during this period of the pandemic, they do take the medication and they're controlled. So those are the things I want to admonish you, and I cannot be too lengthy because I'm sure you may have questions. And please just take what your healthcare professional says to heart.
Thank you very much, Dr. Darland. 4 simple preventative steps. We've been saying it for quite a long time. I think it's important that we all heed that advice, and to be less selfish in our thinking. Think of those who are most vulnerable and those who are not yet eligible to be vaccinated, and let our actions be guided by such. We have a number of media representatives present, but before we go to them, Dr. Donald, you wanted to add something?
Yes. In the midst of this outbreak, our community spread, we just wanted to ensure that we extended some thank yous to all the persons who have helped us along this crisis. So there are persons who helped us technically, persons who helped us in terms of supplies and equipment, and then persons who simply gave gestures and tokens of appreciation to our frontline workers. So in terms of supplies and equipment, we want to say thank you to PAHO, to St. George's University, the Grenada COVID Crisis Group, which is comprised of Grenadian physicians in the diaspora. They've been providing us with technical support and also in terms of supplies. To the Grenada Carriacou and Petit Martinique Nursing Association in New York, to Mr. Darius, Dr. Philip Bonaparte, Dr. Karina David, Dr. Molara Alexis, who came to Grenada to give support on the ground and also brought with them supplies. Dr. Rotfield, Dr. Heather Douglas, Dr. Marcella Campbell, Mr. Terence Griffith, all these persons contributed in terms of supplies and equipment. We want to thank the Mexican group, the Mexican team who came to give us some support in our area of critical care. And then we want to thank the other group of persons who gave us tokens of appreciation. Appreciation to the healthcare workers. Ms. Rita Augustine and team, Sion and Associates, Dr. Beverly Nelson, MTV, Digicel, Hilary Gabriel and the Grenada National Council of the Disabled, Mrs. Lucille Steele and Mrs. Duncan, Island Catering, Rainbow Janitorial, Ms. Walters, Mr. Raheem Frederick, Natalie and Anne-Marie McLeish, all of these persons, and please forgive me if I forgot any name or any group. We just wanted to extend a hearty thank you to all of these persons who have contributed in terms of helping us cope with this crisis over the last few weeks. And of course, the persons on the ground Without our oxygen, L&M, thank you for keeping our oxygen supply on target. Mr. Chris for transporting the cylinders back and forth. Our gas bank operators, you really stood out this time. And we just want to say thank you to all of our healthcare workers on the ground, our housekeeping staff, our orderlies, our nurses, our physicians, even the people in medical records, because of course we have to make sure we prepare all our documentation. So we want to do a great big thank you to all of the healthcare workers who have been stretched during this time, but everybody stood up, stood the test of time, and they worked together to help us deal with this crisis. So we just want to say thank you to all of them. Thank you.
Thank you very much, Dr. Donald. Appreciation and thanks, always important, and there has been a very steady stream of support from various parts of the community, locally, regional, and internationally, even as persons and groups themselves deal with the impact of the pandemic. So yes, we are indeed very grateful. I want to turn now to questions from the media. I note that we have GBN, Mikey Hutchinson, Nisha Paul, and Kellon Bob of the Bob Report. Let's see who has questions ready for us this afternoon. I'll start with Mikey Hutchinson. Mikey, good afternoon to you. Please go ahead. We'll go to Kellon Bob thereafter. Kellon, I note that you have 4 questions. I'll put a limit at 2. Mikey, are you there? You can proceed with your questions.
Yeah, the host was taking a while to unmute me. I'll say hello to your panelists. It's good to see you guys on the press conference today. Dr. Donald, Taisha Donald, I noted that you mentioned there were a few groups and individuals who donated towards your drive, but I also know of persons who have been trying to channel some of their support to your team, but they seem to have difficulties not knowing exactly who they should go to or where they should register their interest in order to help. So can you clarify that for us as well? And my second question is, I know that you spoke of the decreasing number of positive cases coming in. My question is, what has changed that is causing the numbers to go down so significantly?
Okay, thank you, Mikey, for the questions. And first of all, for persons who are willing to reach out, they can contact Dr. Carol McIntosh, who is head of the donations table. And Dr. McIntosh is the director of hospital services, administrator rather, and she's the person in charge of donations. You can also contact me, Taisha Donald. I'm the acting medical director, so you can contact any one of us and we can guide them through. In terms of your second question, the decline, there are different reasons for the decline. 1, that the disease is taking its course. 2, that there's an increased amount of persons vaccinated within our population, and that also helps in terms of curbing that spread. And generally speaking, you have the natural course of the disease. So you have that graph where you have a spike and then you have a decline. So we're now in the decline phase where the disease in terms of spread has taken its course and we're going to now have a decline. Of course, that is also dependent on us following those 4 measures that Dr. Noah spoke about. The wearing of the mask, sanitizing, making sure we get vaccinated and maintaining social distance. So of course, if we don't maintain what we call the behavioral changes, that decline can change. So it's very important that we adhere to these changes, the lifestyle changes, in order to help with this spread.
Thank you very much, Dr. Donald. We go now to Kellon Bob. Kellon, good afternoon. As indicated previously, let's limit to 2 questions, and if we have an opportunity, we'll come back to you for more.
Good afternoon. This is Dr. Bob with the Bob Report. So I have 2 questions, well, 4 questions, but Press Secretary, if you do have time to get back to me for the other 2 questions, that would be lovely. The first question I have has to do with the specific demographic breakdown of COVID patients who have succumbed. The dashboard released, the daily dashboard gives us general demographic metadata, but it's not specific about the age range of the patient. So which age groups have been most impacted and which age groups have been recovering at a faster rate as a percentage of the COVID patients who tested positive over this first wave. The second question I have relates to a concern. Obviously, some of it might be conspiratorial, but that is the concern that has been raised by in some segments of the population, and that has to do with the cause of death of COVID relatives. Some family members, for example, are suggesting that their families tested negative before arriving at hospital facilities across the country, but are then informed that their family members were subsequently tested positive after being hospitalized. And so their cause of death came down to having COVID. I just want to get a sense, perhaps if you can give us a pathological, I know that pathologists are the ones who determine the cause of death. What is the pathological process for determining
Kellen, I think we lost your audio, but I think we also got the gist of the question that you were asking. We were trying to stay on the focus of what we presented here this afternoon, but Dr. Donald will address the first question.
Okay, thank you, Dr. Bob. Thank you for your question. And in terms of the location of the patients, so we have patients from all the parishes in Grenada, with the exception, of course, of Petit Martinique, but patients from all the parishes in Grenada and including Carriacou. In terms of the age range, we have patients from age 18 up to 97. But the group, the highest group would be the person 60 and over. So that is the group that is most affected, the person 60 and over, particularly the ones with the underlying conditions.
If I may answer the second question of someone testing negative and then told that they had COVID. Now remember, the definitive test is a PCR. PCR is done in the molecular laboratory at the hospital, where you do a test to amplify and detect the genetic material of the virus present in that patient nasopharyngeal swab. Now, someone may have a rapid antigen test that is not foolproof. A rapid antigen test that may be negative, but the patient may have clinical COVID and the PCR testing show that they have COVID-19. So I think that's where the little disparity may come in, because a rapid antigen test takes 15 minutes, but a rapid antigen test lacks some sensitivity and specificity, so you can have a negative one and still have COVID. However, the PCR testing may take 24 to 48 hours. So by the time the PCR testing comes, it confirms that the person have COVID. But believe me, as a clinician, when you take your history, you do your physical examination, your investigation, you look at your radiologic investigation, and the whole clinical picture, it gives you a strong suspicion as to whether you're dealing with a COVID case or not. So the disparity would be the person may have a rapid antigen test that may be negative, but the PCR confirmation that actually picks up the genetic material is confirming that they have COVID.
Thank you, Dr. Noel. We go now to Callistra Faria.
Good afternoon, doctors. I missed the first part of the news conference, so I may be straying a little bit from the fencing that has been created for questioning here this afternoon. However, I noticed a change on the dashboard in the way it's presented, and absent now, excluded from the data is numbers from imported cases. Can you explain why that I'm no longer seeing the number of positive cases caught at the border? And also, Dr. Donald, sorry, you spoke in response to Mikey's question about the reason for the drop in numbers, but can you be a bit more specific in terms of, what the current curve looks like? And are we at a stage where we can see a flattening of the curve based on testing and hospitalization? And also to speak a little bit on Dr. Dolland just said that, Dr. Noel just said that the, 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 the antigen test lacks a certain amount of specificity. How reliable are the numbers that we have been seeing since the majority of our tests for the last month and a half or so have been antigen tests?
Right. Good afternoon, Ms. Furry. Let me answer the last part of the question. The director would answer the first part. Now, when you get a positive on the rapid antigen test, almost 100% the PCR is positive. So the ability of a positive test to be positive is extremely high, to break it down in layman terms. However, if you have a negative test with strong clinical suspicions, it may not be entirely negative. You have to depend on the PCR. So almost all positive tests on rapid are positive on PCR, but you may get some false negative. And that happens with all testing.
Okay. So in terms of the imported cases, there are no reported imported cases at the moment, hence you wouldn't see it reflected on the dashboard. So once we have imported cases, it will be included in the reporting. In terms of the curve, so flattening of the curve, apart from the disease running its course, it also has to do with our behaviors. Because of course, right now, you're seeing an improvement in terms of vaccine uptake. More persons are getting vaccinated. More persons are adhering. So, of course, it helps in terms of flattening that curve. So where are we on the curve? We're now in decline mode. So we had a spike, and now we are on the way down. But of course, we've really, we're calling out to the public to please ensure that we try and follow the guidelines. Let us wear our masks properly. Let us sanitize our hands. Let us try and avoid large crowds. And most importantly, let us get vaccinated, particularly the persons in the high-risk groups, because of course that change in behavior can make a difference in the curve. However, if we don't make these changes, the curve can change. All right, thank you.
Dr. Dolan, I don't have a new question, Press Secretary. What I have is that I feel like the question regarding imported cases, can it be addressed more specifically? Because in the past, when there were no imported cases, I believe the line item was there and the number would say 0. It's excluded completely. There's nothing on it that says number of imported cases. So this is what I'm asking, not the number of cases we have now, but why that no accommodation seems to be made on the dashboard now for those cases.
Right. We'd love to answer that question, but you see, you're talking to a different team. We're the clinical management team and not the epidemiology team that compiles statistics. So we're really not equipped to answer that question because we do not have that information.
Thank you.
Okay, at this point, I see no other questions from any other journalists. Kellon just said he had a follow-up question, and Mikey as well. So we'll take those 2 follow-ups, and then we'll wrap up things this afternoon. Kellon, go ahead, please.
Yes, so the follow-up question has to do with treatment protocols at the hospital facilities. Now, previously in the press conference, Dr. Dolland spoke about ensuring that you take advice from medical experts. However, there are some physicians in Grenada who are touting alternative COVID treatments such as ivermectin, the population, some segments of the population seem to go along with the recommendations of these particular physicians. And so my question to you, however, has to do with the treatment protocol that is used at the general hospital or the other hospital facilities and isolation facilities in the country. Can you speak specifically to what treatment protocols are being administered to ensure that COVID patients can leave with a clean bill of health?
Well, the treatment protocol does not just involve medication, and it's a very extensive protocol, and our protocol is based on international guidelines from World Health Organization, Pan American Health Organization, the CDC, the Infectious Disease Society of America, the National Institute of Health. So our protocol was developed based on all of those guidelines. Now, treatment protocol involved not just medication, but fundamentally oxygen therapy, which is life-saving for them because most of them have respiratory complications. And you have escalation therapies like different levels, nasal cannula, venturi mask, non-rebreathable, CPAP, and in the event that all of these fail, ventilatory support. We do not have antivirals, but people get what you call cytokine storm. The immune system is trying to fight the illness, and sometimes it becomes overreactive and start creating many inflammatory responses. So those patients, yes, they have high-dose steroids, dexamethasone, which is the recommendation from all the international bodies and is part of all treatment protocols. Antiviral is on our protocol, remdesivir, which we do not have at the moment. But most of the patients have superimposed infections for which they are treated with the appropriate antibiotics. We do a lot of behavioral changes. For example, we prone our patients. Proning means they lie on the stomach for 12 hours a day so that the lung may expand and they improve the oxygenation and all of that. So the treatment is many. We put them on anticoagulation to ensure they do not have clots, and so the treatment is many. We give them little vitamins to help boost the immune system. It's not for treatment, it's just to help boost their immunity and all of that. But the treatment is multidisciplinary. Now, physicians may have their own little anecdotes. There have been a lot of debate on ivermectin. There have been a lot of research on ivermectin. There have been a lot of papers presented on ivermectin. Some show benefit, some do not show benefit, none show mortality, but there are a few large-scale studies in progress that we do not have results yet. So I guess when those studies is completed, there would be more definitive thing on ivermectin. But people may have the personal preference on ivermectin. We have always used ivermectin in Grenada because in Grenada we have a large population of people having HTLV1, which is a retrovirus that is more common than HIV in our population. And those people often have something called strongyloides. So we have always used ivermectin to treat those people. And to us, it's not a harmful medication when it's used in the correct recommended prescription pattern. So individual physicians have the choices. The National Institute of Health said it recommends neither for or against ivermectin, but we still have to wait for the result of many large-scale trials that is in progress.
Thank you, Dr. Noel, for that very thorough response, one we have addressed on several occasions here at these press conferences. Mikey, I'll take your follow-up now. Please go ahead.
Okay. People who are at home and they are sick sometimes may show some worsening symptoms and so on. And I've noted sometimes they are not sure where they should call or who they should call for at least some sort of guidance on what they should do next. Can you assist us with that, please? And my final one is, I know that there has been a call for the local physicians to help with the fight against COVID. How has that changed since that call has been made?
Okay, for the first question, I'll address that. So persons who are at home and wondering which clinic or which facility is best to the health center closest to them. So let's just say St. Patrick, if they are in the village of River Sally, they can call River Sally Medical Station, or they can call the Sept Health Facility. St. David, if they're in Penmota, or Vincent's, call the clinic closest to them, or they can call the health center, which is closest to them. Or they can call the 458-4787 hotline number.
And in response to your next question regarding the call for local physician assistance, yes, they have. And I mean, local physicians were assisting from before. I mean, we've had persons who have volunteered to work along in the COVID-19 isolation unit. We've had physicians who've come in and done some shifts in the accident and emergency. And presently we have the Grenada Medical Association. They're organizing themselves to assist us with telemedicine, so taking calls of persons who have concerns regarding their illness. So yes, we have persons have heeded that call, and I mean, they've been assisting. There are a few persons who've been assisting since last year. But now we've seen, more assistance coming out. And we also have persons coming out to assist us at the pop-up clinics all over the island. So we have the local physicians coming to assist us at these areas as in assisting in testing and in vaccination at our clinics. So yes, and we're very grateful for that assistance, and we look forward to more assistance going forward. Thank you.
Thank you. Calistro, we'll take the final question from you and then we wrap up.
Thank you. Have you had to treat any vaccine related injuries since we started vaccination? Anyone coming in complaints and related to vaccine injuries in Grenada?
Okay, so so far we just had persons with mild side effects of the vaccine, but no one has reported any adverse reactions to the vaccine thus far. No reports of such. So just mild side effects such as the fever, the headache, the soreness in the arm, tiredness for a few days, but no adverse reactions has been reported.
Thank you very much, Ms. Lyons. As you have the floor, if you wish to give some final thoughts or comments, you may do so that we can put a wrap on this afternoon's press conference. Go right ahead.
I would like to join with Dr. Dalla Noel, with the 4 preventative measures, which is social distancing, sanitizing your hands with alcohol-based sanitizer of 70%, at least 70%, proper wearing of your face mask, getting vaccinated. I would like to appeal to those persons with underlying conditions who are presently on medication to always take your medication as prescribed. Never run out of your medication. If you see that you have some, like the 3 or 4 remaining, please seek medical attention so that you will always have medication at hand. And follow the advice of your doctors at all time. And if anyone is experiencing any flu-like symptoms, seek help. Do not stay home and try to nurse it on your own. You can make a simple phone call so the nurse will guide you as to what to do. Or you can take the opportunity to visit one of the pop-up clinic sites and get tested. Okay? Thank you.
Thank you, Nurse Lyons, for reinforcing the advice that we have been sharing throughout the course of this pandemic. Dr. Noel, your final thoughts and comments this afternoon?
Right, so my final thoughts, again, is to encourage, as I have encouraged all my patients with chronic diseases, my lupus patients, my sickle cell patients, my multiple sclerosis patients, my diabetics, my hypertensive, my renal disease, to please get vaccinated, because you are the most vulnerable group And you are the group that is going to benefit tremendously from vaccination, because it's going to prevent you from getting seriously ill and being hospitalized and even dying if you do contract the virus. Remember, vaccination does not prevent you from getting COVID. But if you do vaccinate and you have neutralizing antibodies, if you do come in contact with the virus, you have a defense already. And it would reduce mortality, you can reduce hospitalization, and it's going to reduce death. So the vulnerable population that I have mentioned, you are the ones that need the vaccine the most. And all of us, let us start taking responsibility for our actions. And let us not just think of ourselves, but think of our elderly, our children, our community, and our country as a whole. And finally, I want to admonish people out there who do have COVID-19. If you have, what are your warning signs? That should tell you that you have to seek medical attention. If you find you're becoming intensely short of breath, you're talking and you're short of breath, you have chest tightness, you're walking to the bathroom and you can't breathe, it's an indication for you to seek medical attention. If you have uncontrollable diarrhea and vomiting and you're getting dehydrated and unable to keep anything down, you have to seek medical attention. If you notice that you're having high unrelenting fever and cough and struggling to breathe, your nails are getting cyanose, your nails are getting blue, all of those are warning signs. And also, if you're confused, you're delirious, and all of that, it's another indication, another warning sign that you should seek medical attention. Thank you.
Thank you, Dr. Noel. And finally, over to you, Dr. Donald.
So a couple weeks ago, I made a plea with persons to go out and get vaccinated, and I have seen some result of that. Persons have been going out, they've been getting vaccinated, and I just want to encourage them to continue. Let us try and achieve a good number of persons, a high percentage. We want to go 60% and over of persons in Grenada vaccinated. And I want to stress on one group, which is part of me, as a pediatrician that I am, is the group of children, right? I'm a pediatrician by profession, and I just want to encourage persons who have children 12 years and over that they can also be vaccinated, particularly the children with sickle cell disease, children with asthma, children with diabetes. These children are also high-risk children, but children in general is a high-risk group. But more so, the ones 12 years and over with underlying conditions, I want to encourage you to get vaccinated. Vaccination is still our best shot in helping to boost immunity against the COVID-19 virus. So get vaxxed. Thank you.
Thank you, Dr. Donald, and thank you to the other members of the panel here this afternoon, Dr. Noel and Nurse Lyons, for sharing the wealth of information that you have. It has been a very positive and uplifting type of afternoon. We had some good news to share. The COVID-19 pandemic is quite fluid, and as such, government's responses, government has to be agile and continuously adapt its responses to the changing face of this pandemic to ensure that we have better outcomes for persons who test positive. So that brings us to the end of this press conference. I am Press Secretary Philomena Robertson. Thank you so much for tuning in. Do continue to stay tuned to accurate and reliable sources of information. Until we meet again, continue to be safe.